Once again, good evening, everyone, and a very warm welcome to another webinar from Signia Healthcare. And ladies and gentlemen, all of you know me. I am Thankam Gomez. I'm the founder CEO of Signia Healthcare. And you have been, attending our free webinars many times over. And anything related to patient safety, I'm very excited. And I'm very honored to be inviting Mr. Rakesh to this show. It's a thing that how did I get Mr. Rakesh on? I know him before this also, but since I am not in hospital, so I did not pursue any dialogue with him because I don't have anything to offer. I don't have any hospital. But then I read one of his articles recently where he had spoken about the burden of hospital acquired infection through linen, infectious linen, and all of us know that. And when I was a nursing head, I know that how much of headache I used to have thinking about who is managing the linen, who is not. And then I had gone around to different hospitals where I had seen, tanks built because for NABH accreditation, infectious linen needs to be, disinfected, putting them in sodium hypochlorite. Though in photos we were not doing that, but I have seen it. People have sodium hypochlorite, they put the linen there. Then I keep wondering, I don't know what's happening to the blood. Is it removed, not removed? It's going in there. I am used to laundry system abroad where you wrap everything and it goes into the machine, sluice machine. It does its own work automatically, everything comes out. I was used to that. But when I started working in India in 2001, that kind of a laundry setup was not available. And I always used to think, when will that happen? And I know that's a pretty heavy work to be considered by one hospital. So when I saw that, immediately I made a call to Mr. Rakesh and I said, would you like to, join us on a webinar so that whatever that you are talking and whatever that you have as a solution, that maybe I can spread the word around and it will do good for patients. So anything for patient safety. So Mr. Rakesh comes with the background of, I don't know, he was in some other business, not in healthcare, and he's a business leader in the country, and he was in other industry. And then he decided to come over to healthcare and start this thing. So I don't want to tell a lot about Mr. Sharma at the moment. We would like to hear it from him only, that how did he end up coming into healthcare. So, by the way, his company not only manages linen from hospital, from other hospitality, education institutions. This is what I could find out. So it's a large setup, and it always makes sense that when somebody is doing a dedicated work on a focused area, that person or that entity will do it much better than someone who is doing 100 things at the same time. So, with that, I would like to welcome Mr. Rakesh Sharma to this show. And thank you so much for agreeing to come to the show and spread this good message to many more people. And I'm sure that the recording will get uploaded and many more will be watching. And in the recording, I would definitely, in the end, ask you to leave the coordinates so it remains in the recording so people can reach out. And if anyone wants to get in touch with Mr. Rakesh, I'm very sure many of you would. Please don't hesitate to drop a message. I'll put you in touch with you. So, infectious linen, which contributes to 25% of hospital acquired infection. And we know that 1 in 10 patients in developing countries will have high, I call it high, because it's a high situation for patients and family. So, welcome, Mr. Rakesh. And without much delay, I'm going to stop sharing this. And first, I will ask you to tell us a little bit about yourself, that you were in a different industry. Why did you decide to come here? So, we would like to hear that first.
Thank you and good evening, everyone. First of all, it's an extreme pleasure, to be with such learned people, specifically clinical learned people. And we are absolute in no mood of putting any gyan specifically as an infection control people, because all the panelists and all the people who are being participants here, they are much, much, much more educated than whatever we know. Probably we are on a decimal points to the knowledge of wisdom you all people possess. Still, we have tried to emphasize a problem and we believe there has to be a solution towards it. That's how we came into this business. As an individual, basically, I'm a chartered accountant and I have done my MBA from Jamshedpur Excelrai. I was working for a steel company. My last job was JSPL, Jindal Steel and Power Limited, as Senior Vice President, Project and Business Advocacy. So I was handling more of the raw material like iron ore, coal, and all those things before my jumping into my entrepreneurial journey, which started in 2013. So we started this company, Quick Smart Wash. As a company, we used to call it Smart Wash for Smarter People. We started our journey as campus laundromat with whatever limited capital we had with the 10 years of my service life. So we used to go, all my brothers and sisters are much educated and they are from BITS Pilani, apart from me, who at that time, commerce used to be the secondary or the third chosen career options apart from engineering and MBBS. I was among the third category of the education list of the family. So we chose commerce. So we went to BITS Pilani as our first project because with their help, and we made them understand for the residential students, you must have seen this coin laundry, ma'am, versus multiple people must have seen. So we customized that according to the Indian student needs as a value addition apart from accommodation and mess facility, which typically all the residential facilities, hostels provides, wherein we invested and we take care of that. Touchwood, it was a wonderful go. We always, as an industrial background of mine, we always thought we should never do a B2C kind of business. So we were always on a B2B kind of front. So we sold our facilities to the universities, and the university in turn charged it with the fee structure of the students. So this is how we started this company. Ma'am, you are muted.
I said any disturbance, I'll mute them immediately. No worries.
Okay, ma'am. Well noted. So, after the initial 2 years, the industrial background always pushed me that campus laundromat is a 10 months business wherein the payouts or the salaries are always, 12 months, and 2 months we are free with no work. So that's how we started looking for some horizontal expansion under the same field of laundry services. So we also, as everyone else was doing hospitality, we thought hospitality would be the best segment. But then, unfortunately, my mother was not keeping well. She had multiple alignments. So I used to always visit, hospitals with her, getting her checked up. And in all the hospital environments, we used to see there's a specific smell out of a linen. The linen was not so well managed. So this is how we zeroed in to, and we thought that, look, there is a problem. With due respect to the best and best of hospitals, we always found that there is some problem with the linen. The mindset was always driven that, look, this is a hospital and you won't get a hotel-like feel kind of linen here. So we were like, we are paying good money. If we are paying, and if I am ready to pay good money, why I will not get a good facility? So that was, till that time, I didn't understand what is hygienically clean linen compared to pictorial green linen, clean linen. So that is how we entered this ecosystem. We started our journey with Jaipur, Mahatma Gandhi Medical College and Research Hospital. It's a 1,000-bedded hospital. And we are very thankful to the owners of the hospital, Dr. Vikas Swankar, who is the current chairman. He is also the AHPI Rajasthan chapter head. So he gave us this opportunity to start at Mahatma Gandhi Jaipur. We started with only laundry services. And to be very honest, within the very first year, probably out of 365 days, I didn't sleep 360 days. Hospital is a 365 to 24/7 days working. Hats off to the nursing association and people associated with this ecosystem, how to manage their family. Any reason whatsoever, if the linen was delayed, it was the laundry people, us, who was blamed. Even if the linen was bad, we were blamed. Even if there was a power shortage, we were blamed. If the distribution was wrong, we were blamed. Anything. Then we thought that this is not going to drive big. In 1 year, my patience was almost zero. And I keep on saying, super hats off again to the nursing ecosystem, how they manage this pressure. So we thought how to drive out a solution out of this. And that's how we built an ecosystem. We call it linen management. The linen belongs to us, the power supply belongs to us. We are not within the premises of the hospital. The capital nature is by us. In fact, the manpower is also by us for the distribution and collection. This is how we made a 360-degree linen management ecosystem. Again, we are very fortunate. We were discussing it with multiple hospitals, and Manipal gave us the first opportunity ever to do this. We started with Manipal Jaipur, and within the next 3 months, we got Kasturba Hospital at Mahe, Manipal. And that's a massive 2,000 plus bedded hospitals with 108 exit. So that was another challenge, very first. We consider ourselves lucky people that the most of the challenging part was on the early phase of our life. So that helped us, apart from the tensions and the pressures, to create new solutions. Each and every time there was a challenge. Hospital, it's a very, very busy place. It's a place full of myriad devices, complex situations. Preventing HAIs, it typically requires an encyclopedic knowledge, wherein every day there is a new healthcare invention. So it's something which we believe required a detailed, thorough process knowledge. Linen management plays a very crucial role towards the same. However, it has been always very looked down in terms of when we talk about patient care or patient care service. So we
Taken care.
Thank you, ma'am.
I think people are very keen to figure out whether they are in the meeting, but muting themselves. It's like, yeah.
So what we can do, we can probably make it more interactive. Before we start a small presentation and then we take up the question and answers, I like to put a few points. Hospital linen, we all talk about cross infection. We all talk about, as in a lot of ICNs are there. We talk about pathogens, this and that. My knowledge, being from the commerce background, is very low. Hospital linen can harbor a significant density of pathogen organisms from 106 to 108 colony forming units per 100 centimeter square, and that's huge. And the most commonly isolated includes the so-called gram negative, which is more dangerous compared to any other nature. So unfortunately, we had a bad incident at our home. My mother got this cross infection due to, at a very not to be named good hospitals. We fought with the hospitals, nothing came out. Then we thought it's a die-hard need, that it's a big problem if we going to an affluent hospital having this problem, wherein the admission is very less, because there are multiple vectors for cross infections, and you cannot zero into a specific reason for that. But still, nursing I've always believed that probably they are the most time spent people close to the patient, even higher than compared to a doctor, with all due respect to doctors. A doctor may meet you 10-15 minutes, can do a surgery ranging from 30 minutes to 5 hours, 10 hours, 20 hours. But the time pre and post a patient spends with a clinical or nursing personnel is much higher. So the uniforms needs to be hygienically clean more compared to a pictorial clean. I'll take you through a small presentation. Ma'am, if you can allow the screen share, yes. So I hope I am visible.
Yes.
Yes. Thank you. So we as a company, post we came into the business of healthcare, we have started calling ourselves Quick Smart Wash, caring second skin. It's a very thought process given to the name before we jumped in. We believe God has given us a skin, which is technically, clinically taken care by the medical fraternity, and linen plays a very crucial role, specifically in healthcare. So that's why we are saying quick smartwash, caring second skin. We are not into any kind of medical cares, so we call it medical care beyond boundaries. 2013 we started this, blah blah blah. Very important aspects. We, as markation or awards. So we are the first company ever awarded by CINAT, CINAT, world's largest or biggest textile care body, as the most professional textile service care segment in India. We are also very proud to state all the central processes unit across all the 14 cities we have got are green building accredited by SOCH. So I'll come to the advantages part of that. As a company, we have a care, commitment, convenience, CQ motto. So this is a small journey, 2013, 2025. We started healthcare 2016. 2018, we started the linen management with only 2,500 beds. By 18 to 23, we are almost 25,000 beds. So in 5 years, we made ourselves 10 times. This is a very, very acceptable model overseas. Once we came into this ecosystem, I traveled a lot of countries, like ma'am says, and multiple other people have the rich experience. How linen management is done in USA or UK or Japan or Australia or New Zealand. So they have a backtrack record towards the, and we are trying to develop the same ecosystem. And we are absolutely confident of reaching 50,000 by 2025. This shows the acceptability of the process in the healthcare ecosystem. Current locations which we serve, locations by March 2024 we will be serving. So this is something good happened to us in 2021 March. A Japanese company called Elan Corporation, they are the largest allied healthcare service provider, serving 1.6 million bed every day with patient care, care sets they provide to people every day across Japan, southern China, Australia, and Far East countries. So they boarded us. They also brought a lot of technology part and the value addition to the entire process we do. So linen management, it's a culture. We call it, it cannot be an opinion by an individual. Say an ICN head may require a linen management, but it has to be followed by each and every last mile people on the ecosystem. So that's what we call a culture with everyone's attitude. The thought process needs to be changed more than the process needs to be implemented. We all know. So this is, we always think we are very close. Every hospital has got a patient care service department. We have tried to convert this into a patient care perception department, apart from patient care service department. And we believe linen plays a very crucial role towards it. Something as a technology part, wherever we serve or whichever hospital, we clean the linen after taking it, the soil linen from the hospital in the requisite format and start the washing to it. The hospital can log in, or any person. I think somebody from Aster we have. So Dr. Anup Warrior is the ICN Aster group. We had somebody from Aster, right?
Somebody was.
Yes. So Mr. Prasanna, I believe you know Mr. Dr. Anup Warrior, right?
Yes, sir. I know him. I know him.
Yes. He is your ICN head.
Yes, sir. Infection control head, sir.
Yes.
ICO.
India's Aster group, sir. ICO, Infection Control Officer, and
Yeah,
as well
ICO,
as head of the Aster Ashlar hospitals in India.
Yes. So I think he is also on the board of NABH as a executive member. So he was something who really praised us. Each and every batch, whatever we wash, and so-called ICO can sit in his or her office and can watch what thermal disinfection we have done, what chemical disinfection we have done, what is the drying and what is the temperature we have taken, what is the time we can hold. And he and she can watch it from his or her office itself. So this is something we are really proud of. What is the chemical dosing we have done? Each and everything is utmostly transparent. So that brings the confidence of ours into the ecosystem. We always say pictorial or sensorial cleanliness is never equivalent to hygienic cleanliness, specifically in healthcare ecosystem. Multiple vectors we always find, out of which linen is a very, very, very crucial form. And we all have multiple reports towards the same. So this is a picture we are very familiar, more familiar due to the COVID-19 pandemic. So what does this picture tells us? So different people have a different concept towards looking at it. We are seeing a nurse maybe wearing a gown, wearing a face mask, wearing a mask shield, wearing a hair shield. So what does this prevents? These all equipments prevent him or her from getting a barrier between the direct infection to be acquired. Similar process can be brought down into the linen management or the functioning of the linen management. So what is a barrier? A barrier is something which we create a clean zone and a fresh zone. Different zones have different air pressures, and if that can be created very easily. So the machine operates from the soil side. All the soil linen has to be inserted from the soil side, and the fresh linen will come out of the clean side. The machine can be opened only one time at one side. It can be auto-programmed towards it. Plus, it can be opened only after the completion of the desired time frame. And that's a complete separation between the soil side portion and compared to the clean side. So this is something we have got at multiple other locations. So this we call it a barrier laundry. So on the back side of this is the clean side of it. On the back side of this, we have the soil side. So this is a graphical presentation. How does a barrier concept work? We call it a straight line flow process with the red arrows marking the soil portions and the blue arrows marking the clean side of it. This is a typical process flow in terms of you see the yellow colors. It will keep on changing step on step. This is the transportation of the laundry from the soiled rooms or from the hospital to the processing unit. Now we do the sorting of the linen. It is a very crucial process why we have to sort it on the basis of color and batch wise. This is pouring of the soil linen on the barrier laundry from the soil portions, getting the desired process on without any interference, and the chemical has to be done with an auto dosing process, which can be monitored if we allow or access has been given to ICO or the housekeeping head, anybody, he or she can monitor it sitting at their respective hospital or office itself. Then this is the taking out of fresh linen. The desired linen goes for calendaring, it goes to calendaring, finishing goes to finishing, folding goes to folding. Then it is all packed and stored back in the trolley, and then it goes to dispatch. So what does this process help? This actually helps in a proper stoppage of cross-contamination. This is the most vital thing in the entire system. So this is typically 8 steps, we call it, in linen management, starting from the collection, that is step 1. circulating it and going it back on step 8, properly giving it a fresh linen in the clean trolley. All the 8 steps can be done by us, and we can take care of each and everything. How does we never call it a win-win? We call it a win-win-win solution. The entire, when we do the linen management, the entire capex is invested by us. As our healthcare clinicals, this is a non-core competency center for you all people. So we also keep a track on the operating costs. There can be various substandard or multi-standards uniforms and process. So we do a standardization process focusing on our core competency, logistic, stock management, everything. So we can take care of everything. What is the 4 major outcome we bring it for the hospitals? One of the major important point is focus on the core competency. So we have summarized this. We call it incorporating technology in saving the valuable time of specific nursing department, maintaining hygiene and bestowing a longer life to linen with a total care towards environment. All the plants which we have are green building accredited, entitled or equipped with an effluent treatment plant, followed by a ultrafiltration process and a reverse osmosis process, wherein we can recycle 72 to 76% of water again. Majorly of our plants are also backed by solar energy. So as a company, we not only do business, but we also have a driving force sustainability. So this is our goal of 2025. How do we can bring a lot of water saving and do a lot of CO2 saving. These are the few hospitals which have made us very proud of. Manipal, Fortis, Aster, Care, we are very deep into. Rainbow, and then multiple other standalone hospitals. So these are few accreditations, which has made us also more healthier. All the buildings are green building accredited. We have got the most sustainable award India by Senate. So this was a small presentation from us. Anything we would love to answer and take the entire thing one-on-one, that would be more better, or on the platform.
Thank you, Mr. Rakesh. Thank you so much. That's very, very impressive. So I have a few questions. Maybe these questions are in others' mind also, because I had been a nursing head for many years, and this linen management was a headache for me. So number one, it's very heartening to know that you take over inventory, right? There is no inventory. So now, tell me the process of inventory when you maintain. In your experience, do you lose linen or do you have a lot of damaged linen? Because this is what, the complaints, we used to have patients who will call us and say, ye dekho, isme hole hai. Okay. Then nurse will say, we will tell the nurse, why didn't you open it before you give it to the client? Then you say, ma'am, I cannot open every single linen. Then I am fighting with the laundry guys, saying you should be checking before you fold so that, my nurses are not wasting time. So I am trying to understand how is that experience, I don't know if someone here already is getting your services. It'll be nice to hear from them that what is the benefit that they have had, is from the horse's mouth. But nevertheless, I would like to hear from you. What has been your experience?
Yes, the beauty part of it, when we are doing our linen management, from our side, the TAT is absolutely zero.
Okay.
When I say a zero TAT, it means the moment we collect the soil linen, immediately we deliver you the fresh linen.
Okay.
When the linen goes to laundry, when it comes back, the healthcare ecosystem is least interested to know, and it's not their cup of tea also to know. So that's how we maintain it, because of the high level of par level of linens. In this scenario, definitely with due respect, as a country, we still have a percentage as a pilferage. I'll be very honest with you. So on this platform, it's not a blame game to anybody, but we understand this. We cannot go back and check every patient's bag and all those things. So we have got a percentage of pilferage. We always try to keep it a very healthy percentage of pilferage. Below 3% is very, very healthy.
Okay.
If on a YOY basis, on the number of piece count, it is below 3%. It's a very good managed things.
Okay. Okay. And do you also manage the scrub suits and uniforms and everything?
Each and every item, starting from front office to the last, maybe a wrapper 100 by 100 or a cautery bag.
Oh, wow.
So there are three natures. Yes, now we come to the actual business particulars. There are three natures of linen associated with a hospital. Number one, we call it flat linen. That includes bed sheet, pillow cover, blanket cover, blankets, face towel, hand towel, bath towel, doormat, anything that is flat of nature, we call it flat linen, which goes directly into the ironer or the flat work. Then it comes to uniform, from a patient uniform also to the security guard uniform.
Okay.
So this can include your SR, GR, GDA, GRE, whatever it is. We provide every single person with 3 sets of uniforms.
Okay.
One she can wear or he can wear, one as a backup and one in the ecosystem of washing. So it is a rotational process.
Okay. Mm-hmm.
And then the third nature is definitely the OT linen. So the OT linen contains any nature of OT linens, from the scrub suit to the wrapper, to the cautery bag, to the table linen, to the plain sheet, you name it, with Macintosh, without Macintosh, half Macintosh, we provide everything.
Okay. So if someone wants to work with you, then what happens to their current capex that they have already invested in the linen and uniform and everything?
So we have kept this ecosystem very simple and straight away workable. So when we do our linen management, before I come to that process, I don't know how many people knows here. Have we ever calculated what is our load per occupied bed? I don't know anybody from finance of the healthcare system is there or not.
Okay.
Anybody from the finance background from healthcare?
I have not heard this terminology, at least when I was in
Yes.
Focus. I never heard it from CFO. I mean, I used to sit for, finance review, but I never heard this particular
Yes.
linen. They always used
So
to say how much linen was, condemned, what was the cost of it, and, how much we lost and all these things, and how many linen are unusable, because when you open it to the patient, maybe the quality of the, so these were all the discussions. So that's a very interesting terminology. We would love to
yes.
know about that.
So we have done a maths, based on the experience and the quantum we are handling. On an average, including these three nature of linen, flat linen, uniform, and OT or ward OT linen. OT linen goes into ward and also into the OTs through CSSD. It accumulates from 5 to 8 kg depending upon the so-called category of the hospital. Not naming, but for a hospital level of say Kokila Band or FMRI may have a higher load per occupied bed compared to a standalone 20, 30 or 50 bedded hospital. Definitely we all knows this. So the healthcare ecosystem works on per occupied basis. We call it ARPOB, average revenue per occupied bed.
That
and
is
then yes, most commonly used lingo into the healthcare ecosystem. The so-called nursing heads are under always immense pressure to reduce the consumption of the consumable and all other things. How to reduce this ARPOB, how to reduce the cost or the burden on the ARPOB. with an excellent nature of linen, all linen equipped with RFID,
Okay.
including the manpower for the collection and the distribution of the linen,
Oh, wow.
including the replacement of the discard, including the pilferage up to 3% on a year-on-year basis. From 5 kg if we start, the average cost per occupied bed. Any guess? I don't know what can be. I would love to hear somebody,
I don't know, guys who all are on the call. Will anyone like to take a wild guess? He's asking what is the cost of managing 5 kgs of linen per bed. Am I right? That's what you are in simple this thing, right?
yes.
Yeah. What could be the cost? 5 kg. Even if you think of a Dobie also, you will come to know some cost because even the Dobies are charging much more per piece. It is really per piece they actually start charging. So since nobody's putting anything in the chat box also, let me see. There's one new message. Let me see. Okay, we'll take these questions because there are some questions here. Now, there are no answers. We would love to hear from you. You're muted. You're muted.
Yeah, sorry. So it ranges from 200 to 300 rupees only.
Okay. 5
So
kg.
5 kg to 8 kg, it ranges from 200 to 300 kgs, including linen, including the laundry service, including the manpower, including the replacement of the discard, including a pilferage up to 3%.
So if you compare that to a hospital taking care of this entire service, how much will that be? Just an approximate figure.
So I've done an audit for multiple hospitals, not to be named. I've seen bizarre number. I've seen number as good as 600 rupees.
I can very well imagine because there are so many factors in the linen management. It's not just one because though I would have loved to tell this is admin's job or housekeeping job, but no, nursing can never stay away from that. Number one, always getting calls. Linen is not there, shortage, and it is there, but it is not of good quality, and we have premier clients who are paying quite well, and they would love to have not, as you said, not just looking nice, but
Yes.
also feel good and
Feel
also
nice.
not damaged. So I think looking at the time, there are multiple questions here, so if we can take those questions, it will be good.
Yes.
uh, so
So on a summary part of that, so if you calculate that with the average RPOM from a 2-tier to a 1-tier city, it is 0.4 to below 1%.
oh, wow. Okay.
So now why I made this point, it's such a crucial element in terms of HAIs,
Yes.
wherein this so-called cost center of linen management is below 1% of your average RPOM.
That's very, very impressive. That's very, very impressive. And I can very well imagine how that will tilt your Excel sheets. I think I mean, larger the hospital, probably more saving, right?
So we believe, with again due respects to standalone hospitals, out of the so-called top 10 to 12 corporate hospitals, we are currently working with more than 8.
Okay.
So whenever there is a crisis management or reduction of the cost, we typically try to fall on the allied service.
Mm.
And linen management is one of those, wherein we are trying to reduce something which is below already 1% of your revenue part,
Okay.
which can actually create a better perception towards development of the brand value, patient experience, and making the life of a nurse more easier.
It makes the life of the nurse easier and everybody in the system because we are
Yes,
putting the manpower. So
absolutely.
there's a question. They are asking that, if suppose you are taking care of the linen, do we need to disinfect the contaminated linen?
Not required. It can be packed in the soluble bag and it goes
Yes.
straight away in the washer extractors.
So this biodegradable bag, that also you take care?
Yes,
Bag also you take care?
absolutely.
Okay. So this is for everyone's, information. This is special bag, which I think it goes inside the machine, sluice machine with the plastic, with the cover, right? Nobody
Yes.
handles it because your machine has got all disinfectant and everything. I mean, I saw this when I was working in Saudi and Doha, this many, many years ago. So I was very impressed that, nobody has to touch the linen. You just have to pack it in the bag once and tie it off, and they just throw that into the sluice machine. Then it gets sluiced and then it gets into the normal,
Yes. So the
washing.
bags are also soluble at a specific desired level of temperature
Yes,
from
exactly.
55 to 75, depending upon the time you hold time.
Yes, yes, I understand.
Otherwise, the machine would be clogged.
I know. How do you manage stained linen?
So you can
They
say
are
that that's
very happily asking this question, because we always used to have problem with chlorhexidine and iodine falling, and we are trying to figure out how to get rid of those stains, and they come back with the stains after washing. So there's a very, very practical, relevant question somebody is asking. Yeah.
yes. And one more question somebody has put, Mr. Jitendra. I'll love to answer that before I answer this one.
Okay.
So that's the USP we have brought into the ecosystem. You need to understand what is our business. Our business is linen management, not laundry service. The moment we own the linen, for us, there is a huge skin in the game.
Yes.
Our earning depends, I'll be very honest, my team may not like this. Our earning depends on the better life of linen. To make the life of the linen better, we have to treat it like a second skin, very gently, very properly, and it has to be stain free. So that's the USP we have brought into the system. As a principal, if I'm a nursing head or something of a hospital, I'll say to a partner, quick smartwatch, look, I need stain-free linen with maybe 85% whiteness on the last day of the life of the linen. Simple. We are proud to state all our agreements are SLA driven.
Sure.
No, so we state that beforehand of the agreement. This happens, this. So this gives us the beauty, and with the multi-par, it helps us to make the process more smoother and make it more stain-free. I'll take this one more minute to add on. During the COVID, we all used to use, chlorhexidine hand sanitizers.
Yeah.
So typically there are two colors of, to make it more simple, hand sanitizers. One is the pinkish form and one is the bluish form.
Yes.
In the pinkish form, most people knows also, the percentage of chlorhexidine is much higher compared to the bluish tone, which is more dilutive form, right? So COVID, there was a sense of uncertainty. Everyone used to take the maximum possible, 1, 2, 3, 4, 5 sprays. You should put it 5. However, there is written that you should have 3 ml, soak it. If above 3 ml, you have to give it air mist dry. And nobody should do this because of the excessive soluble in our hand. It used to get sticky, and we used to keep it on the corners of the bed sheets, hand towels, and they formed a special darkish brown, non-removable stain.
Okay.
We understood this. So this is not something, we also need to understand. See, cotton, what is linen? Linen is a cross interception of threads. The more the threads per square centimeter, the higher the nature of the linen. So you may have a 60-60 counts, you may have an 80-80 counts, more fineness. To make it more count, the linen threads has to be more fine, right? So we understood this, and we tried to. So this was of a culture practice. That look, you cannot take the entire bottle in hand and rub it with the bedsheet. Even if you are having one pressure and taking the liquid of 2 to 3 ml, it's more than enough.
Okay.
So that's why we said that linen management is a culture. It cannot be an opinion that we are having or somebody else is having. it needs to go into the spine to the last possible vein. The last person who is picking up the lane, the outsourced GDA people typically, they needs to understand this. It's a training. We have learned this and developed this over the years. It's never a one-day job. Then later on, what happens? We all start fighting each other. So we have to understand this and make it more one-to-one driven as our own linen. Because for us, the prima facie cost is linen, which is higher than the actual laundry cost. If my linen life is shorter.
Yes, totally get it. Yeah.
Yes.
So, Smita is asking, so do you provide different color coded bags for soiled or contaminated and non-contaminated?
Absolutely. Yes.
So, for the soiled, are you using yellow color?
Yellow color. Yeah, that's the pre-NABH defined norms.
Yes.
So, Mr. Jatindra ji have asked that as per NABH auditors pre-treatment necessary with 1%, it is with due respect, all due and humble respect, it's an old conventional way of thinking. If you go to GEC countries or go to Japan, there is no sodium hypochlorite in the entire hospital premises. So gone are the days when you used to put it in the tub for 30 minutes, 1%, 10 liter of water, and then nobody is looking into. And after 2 hours, we are sewing pin holes in the linen, and then the laundry partner and ourselves we are fighting. So it's an absolute old process, which now as a company we use all the chemicals which are enzyme based. While we are spending more money on chemical for bettering or bestowing a better life to the linen. See, today, when in the linen management, we are owning the linen. It's the property belongs to us. If there is a match towards every business, right? And if the moment the life of the linen is shortened, we are short on the revenue. Absolutely.
Exactly.
So we need to think how a good quality linen is delivered with a more longer life than the so-called calculated Excel sheets life. The better it is, the better it is us. So you have a partner who is putting his skin in the ecosystem.
Yeah.
Yeah.
I think you are taking the headache of everything. So I would just like to add to Jitendra's question. NABH does not ask. Please understand that. NABH is not the one setting those standards. These standards are set by Ministry of Health and Family Welfare of India, which is similar to what CDC recommends or the WHO recommends. They only talk about ensuring that the infected linens are kind of soaked so that it is not going to be a danger for the people who are going to handle. And these linen should not get contaminated. This linen should not contaminate the other clean linen. So you are ensuring that it is disinfected, then everything is washed together. So that takes me to the olden time when the laundry was being outsourced. So what NABH will definitely ask, if you have a partner, to go and audit their premise, that how the linen is being managed. So this soaking of sodium hypochlorite is mostly when you don't have good laundry partners who will take care of the linen. Because in my hospitals, wherever I work, I have never done any sodium hypochlorite soaking. And please understand, sodium hypochlorite life is so short. After some time it's just water, then you may be just putting it into the water only. So it is not, NABH is only asking you to prove that you are managing your infected linen and biomedical waste management as per the set guidelines. So you have to know that how your partner is disinfecting, and whether you have some document which says you have audited, or they just have to show them that this is how we are ensuring the partner who is washing our linen has got the right things and the right people. Because even the people who are working in the laundry, their health checkup, their vaccinations, everything needs to be ensured. This is what NABH is asking for. Many times we misinterpret the standard, and then we tend to succumb under the questioning of the assessor. So I wanted to just tell that. So there's another question, that disinfection we already talked about. Do you provide the linen in packets? They're asking, like, in one set, one in one plastic bag, or you give it.
No
I think
plastic
they're trying
bags.
to visualize.
Yes, so I got it. So
Plastic is
no
not
plastic
allowed.
bags. Yes, actually.
Yeah.
So all the accessories which we use are SS 304. There is a clean linen trolley covered with a linen cloth which is washed for every cycle, and then there is a soil linen trolley which is disinfected every day.
Yeah.
So this is the process. So how do we deliver? Like, it has to be a bundle of bed sheets, a bundle of pillow covers, a bundle of maybe a wrapper 100 by 100, a bundle of double hole sheet, a bundle of patient gowns, a bundle of patient pajamas, similarly. So you can pick and make your sets accordingly. There are hospitals wherein we also manage the CLS. We call it Central Linen Store.
Yeah.
So we, at multiple hospitals, we are the people who are running the Central Linen Store 24/7.
Oh, okay.
Yes. So I don't have the picture right now. Otherwise, for a teaching hospital like Kasturba, you all will be very surprised. I don't know if anybody from Kasturba, hats off to the entire nursing team. They agreed to us. We said that we issued a small gate pass and a jute bag to multiple jute bags to every ward. Whatever linen you dump in the bag, put the sticker, make a sign, and put a note. That's the trust we have created. Whenever we are opening a bag, it's under the desired camera circulation. If the manager at the then time of opening a bag found a discrepancy in the content as written to the on the slip of the bag, he immediately calls and then informs that this is plus one bed sheet or plus two bed sheet, something of this kind.
Yeah. Great. I mean, those who have still got a bit of confusion about, disinfecting the linen, I would request you to even message me. I will tell you that, why we are, misinterpreting that, then I ask a very simple question. If all the infected thing needs to be disinfected, then all the gauze and the dressing that they come, we have to soak them also. Why should we throw them into the, biodegradable bag?
Best. Yes.
Because there is a final destination, you are
absolutely, I've nailed it.
Right? So please don't get into that. I can tell you, the assessors, when we stumble, when we fumble, they will also then probably, make your life a little bit more miserable. So don't misinterpret. There is no standard which says, it only says that you should have a process of ensuring infected linen is handled properly. That means the moment the infected linen comes out from the bedside, it goes into the bag. It goes into the bag, it gets tied up, and then it goes separately to the person, or to your own laundry, or to Quick Wash, or any other company for that matter. They are supposed to take care of the disinfection. And what Mr. Rakesh just mentioned is the most cleanest, neatest way of doing that. That means it goes into the bag, it goes directly into the sluice machine, where the disinfectant and enzymatic cleaner or whatever is required is there. Once they are properly disinfected, then they get into the normal washing cycle, automatic. I mean, it's very nice that if you are in a city where he has got a plant, please go and see, because even if you are not hiring, it's a very good experience. I have seen it many years ago. I was super duper impressed, and I was waiting that who will bring that to India. So I'm very happy. Someday I am going to visit your plant, if at all, if I get a chance. I would love
Absolute
to see
honor.
that. So please, this webinar was to actually ensure that all of you get the information that better. And even for leaders, it's very important to understand what is happening today, what is the business model, what is safe for patients, what is safe for nurses. I mean, nurses' life is going to be far more easier for, I mean,
I'd like to value add something, ma'am, if you allow
Yes.
me 2 minutes.
Sure.
When we do an audit, so-called, NABH or anything with any partners. A healthcare premises falls under a lot of compliance.
Yes.
If somebody wants to set up a hospital, which every doctor in this country has a dream of, or probably every doctor on the planet Earth has a dream of. So there are 2,248 compliance.
Oh, that's a good number to remember.
Yes.
248. Okay.
Yes. So I learned this from Dr. Sanjeev, Amrita, and he said, Rakesh, it's and out of this I have a compliance for laundry. So he says, bullshit. I'm not going to do this, Rakesh. I have 2,248 to look after. We take immense pride in stating that all the laundries which we have established as of date and time, it may be, because we have got a compliance-oriented country partner, so-called Elan Corporation from Japanese. Japs are considered as one of the most hardest compliance-oriented people, probably globally.
That goes with
So, so they are very particular in what is the pollution control board license, how do you retreat water, what is the nature of detergent you are using. It is surfactant based, it is enzyme based, what kind of wash cycle you are doing, acidic, non-acidic, what is the delivery of the content, what is the pH, how much time you did a thermal disinfection, what is your chemo disinfection process. These may be a little different or new kind of lingos, but this is actual audit for any laundry. This shows the person has, or the company has put a lot of money into this, and why they are claiming such a high percentage of success rate. So this is very, very important. In fact, we are also doing multiple hospitals with RFID. There are hospitals who proclaim, look, we are happy to pay Rakesh maybe 350 rupees per occupied bed, but I need this linen to be discarded in a 50 or 60 or 70 wash cycle. So that's something very good. Globally, anywhere on the planet, developed country planet, and the price at which we are doing it is India is 50% less. So that's huge. Or you can say they are doing it at 100% cost.
I can imagine. Yeah.
Number two, the load per occupied bed, which ranges from 5 to 8 kg. You go to any Japanese hospital, it is above 12 kg.
Okay.
You go to any European countries, it's above 10 kg. So the frequency of change is very high. So though I have seen a hospital, proclaiming third decimal digit HAI.
What does
and they
that
monitor. So they mean, so they are 0.00 something or in terms of HAI.
Oh, okay.
And they have a record of this. I was like, hats off. Well, thinking this gets a goosebump. Third decimal point of keeping a HAI record for all the 17 parameters.
Okay.
So 17, 18 parameters, apart from the clinical perspective. This is non-clinical perspective.
Okay.
So that the thought process itself, it's dangerous to think of. But yes, as a country, we definitely are changing. As a people, COVID has propelled. As an attendant, whenever now we go to hospitals, we are more conscious. We look around, we see whether things are clean or not. We are asking, with more and more the government making a so-called capping into the healthcare ecosystems, probably tomorrow it will be always based on service.
Yes.
So we need to start thinking this again in terms of cost. The highest cost which we charge for a two-tier city also, it's below 1% of their ARPOB. So that's a negligible cost to the entire revenue model. But that can create a longer term value addition, and the patient can go back happily and say that, look, we should go and treat ourselves or our patients at this hospital.
Yes.
It's a very unfortunate thing in our country. With all due respects, again, we are a so-called doctor-driven. I've said this at two platforms. Many doctors don't like this. We are a doctor-driven country. So we are also associated with multiple healthcare nursing associations worldwide, like the Japanese Nursing Association. We are part of it. So we are also part of Southeast Asia Nursing Association. As a country, we have immense talent, and we believe, we are thankful to any platform and Thankam ma'ams, for this, that we should take our platform also to those levels wherein the impounding stress life of a nurse actually can be managed and be more relaxed, at least from the so-called non-clinical activity.
Right.
This is what we believe.
Thank you so much. I think that's a wish come true, and I totally, 200% I am with you that if I was in a hospital, I would have 100, 200%, taken this message to the management to see, let's look at this. There was a question from Ma'am Usha that where are your plans? Maybe some of them are planning to come and visit the plants. You're muted. Sorry, you're muted.
Sorry. So in terms of north to south, so we are there at Jalandhar. We are there at Manesar serving Delhi NCR region. Definitely we are big at Jaipur. Our HO is Jaipur. We are there at Lucknow. We are there at Bhopal. We are there at Bangalore, Hyderabad. We are there at Manipal. We are there at Mangalore. We are there at Chennai now. We are there at Kochi. We are coming up at Kannur, Ahmedabad, Calcutta, Bhubaneswar within this financial year.
Mumbai?
Not yet.
Not yet. So those who are sitting here from Mumbai, please watch out, reach out.
April.
And see,
So we have tied up with a big hospital in Mumbai, but we are subject to open April or May 2024.
Okay, great, great, great. So great session. Thank you very much, Mr. Rakesh. And anyone wants to get in touch with Mr. Rakesh, let me know. I can share the number and you can get in touch. And he has displayed his coordinates on the screen. So please, I can only say that, I have not heard of any other company who is actually managing end to end. I've had outsource where, linen, I don't know how much can I stress how painful it was. And my nurses, some point of time I had to fight because my nurses were spending time counting the linen. I said, no way. I mean, they are not supposed to be counting the linen. So, but it's a very, very progressive and very heartening change that I am seeing that, you have come in with such a solution. And I wish you all the very best. And I wish that, more and more hospitals will adopt this. And it seems to be a very efficient model. That's also very important. The cost is, like as you explained, the headache is a different thing. Headache is anyway taken care of. That's the cost is very, very manageable. So I really hope that, wish you all the best and spread more. And I hope through this webinar, some of you might be interested to look at what Smartwash is doing. And please go ahead and see that. I am also deciding to come and see one of your plants somewhere, in one of the places wherever I visit or somewhere. And wish you all the best. And thank you very much to all the audience
Thank you.
who joined us today.
Everyone, thank you for sparing the time. Thank you, ma'am, for giving us the platform. And we believe we can make the world change in our possible way.
Yes, because anything that matters to nurses and patients, it matters to me. So that's why I reached out to you. Thank you for making the time and being here. We have taken more than an hour. Thank you very much. Wish you all the very best. And thank you, everyone. And in case you have not noted, Mr. Rakesh coordinates. If you have any queries, let me know and I will pass on his WhatsApp number to you. Is that okay, Mr. Rakesh? I'll pass on your number.
Absolutely. Okay, ma'am. Should I put it down in the chat?
Yeah, because chat they may not.
Okay, done. So it's better you can pass on to the audience.
Yeah, I
no
will
issues.
pass on, not a problem.
Absolutely.
Thank you so much. Thank you and take care. And bye bye,
Thank you,
everyone.
everyone.
Good night.
Thank you.
Bye.
Bye. Good night.
Night.
Thank you, madam.
Thank you.